I love it. Okay, Spencer, take it away, man. I can.
Sure.
Oh, wait. I know what's gonna happen. I haven't shared. I gotta share because like we see your screen, but the people online don't. Oh no,
Oh,
wait a minute. Do they, Ramesh, do they
We see it. We see it. Yeah.
oh, okay, we're good. Okay, good. Never mind.
As long as you see it, we're good.
Yeah, okay, wonderful. Spencer, all yours, man.
sure. And I guess first let's say Pascal, thanks for inviting me to speak. Pascal was more than just a little involved in the business. Pascal was our chief science officer and took part in everything from the clinical validation of our product to fundraising to investing to putting together devices. Like it's a really from start to finish the whole startup experience journey. Pascal was part of it. So yeah, I'd say a little more than a little involved, Pascal. So I guess I have a deck pulled together that covers the story of the business, and I think you all just went through a lecture on the different ways of financing a business. So I've covered all the different deals, or at least the meaningful deals that happened over the 7.5 years of Ace went from uh, startup to exit. But I'm going to start with what am I doing now? Because I now I guess I can call myself a serial entrepreneur, where I started a business, exited that business, and now involved in all kinds of different companies. So one company that I founded, Active Chalets, we have 4 doors in Quebec, short-term rental business on Airbnb with our own customer journey. I consult with a company out of the UK, Amba, that makes a caregiver platform to be the source of all truth for anything technology and residential living facilities. I'm helping a company called Solo Traveler, which is a solo travel publication. I'm helping facilitate their exit. There's a company called Lucid Therapeutics that I'm helping expand to the US. They are a music therapy company where they integrate using AI, gamma, beta, and theta waves into regular music to help seniors become less agitated and reduce their anxiety. There's a company called ComSense that I'm helping facilitate them look at a new market segment. They're an ERP company that currently sells to construction companies and helping them expand their product into the electrical sector. I'm a board member on the Boundless Accelerator, formerly known as Innovation Guelph, one of the larger regional innovation centers in Ontario. I'm an advisor at both the Center for Aging and Brain Health Innovation and the Mars Discovery District that gets me exposure to a bunch of interesting startups. Another company I founded is Sync. It's a fun, direct consumer rolling knife sharpener, make cool ads, and have a customer buying journey. And from all of that, I'd like to end the day with a mimosa where I sit on the board of a company called Sunday Fun Day that they do pre-packaged mimosas. And I wanted to share this as an entrepreneur. You don't really go through a career path. What you end up doing is when you found a business, you're at the top. You're the CEO, you're the president, founder, whatever you want to call yourself. So there's no ladder to climb. You're building the ladder. And what you end up doing is you build a career portfolio instead of a career path. And I wanted to share before I jumped into Ace Agent Carry, this is what my career portfolio is currently looking like. So Ace Agent Carry, this is a photo of the product that allowed me to be doing what I'm doing now. It's the company was Ace Age, the product's Carry. It's a device that was designed to make it really easy to take your medication properly. And to help you understand how it works, you have to understand the pharmacy infrastructure that we plugged into. Instead of using pill bottles, like your typical pharmacy, you go, you get your meds in a bottle. We use a compliance packaging format called multi-dose pouch packaging. So you see in the center here, it's a strip of it with a bunch of different pouches connected to each other. There will be, the first pouch on the top that would have, like, say, your morning meds inside of it. The second pouch would be your afternoon meds, then your evening meds, and then it would repeat itself for a couple weeks, a month, however long your prescription is for. So we partnered with pharmacies that dispense this way, and we had them put it inside of a cartridge, and we delivered that cartridge to patients. So they would take it, it would look like that dark thing on the left side there. They would take it and they would put it inside the back of their device, and that would be all the setup that they would have to do, because the device would read all the information on the packaging and automatically schedule. So say, for example, it will know that your dose is due at 8 a.m. tomorrow, and you just have to wait until the device lights up, made a nice noise, and you would press that button to get the medication you need at that exact point in time. So really easy, really straightforward, provided a lot of value to patients, keeping them healthier, keeping them independent, keeping them out of the hospital. We had quite a lot of success rolling this out across Canada and worldwide. So this is, the whole journey from 2015 to 2020 that I took with this product and business. And I'm going to take you through the major steps and major funding milestones year over year. So going to 2015 is when I founded ASage. And that came from a personal story, watching my grandfather use one of those Monday, Tuesday, Wednesday plastic calendar boxes very unsuccessfully, where he kept taking his meds incorrectly and kept going to the hospital. And I first went to market looking for a better solution as a customer, thinking surely something exists that my 85-year-old grandfather with early onset dementia could use naturally. And when I couldn't find anything, that's when the idea of a med dispenser was I first thought of it. Then I was luckily having dinner with my father's girlfriend's daughter's fiance. Everybody got married, so he became my stepbrother-in-law, and then everybody got divorced, so now he's just a friend. But he was doing his fourth year mechatronics course at the University of British Columbia and needed something to design for his final project. So I told him about the idea, and he ended up building an ugly plastic box. But that ugly plastic box solved a very important mechanical problem, and I thought I can build a business around that. So I was working in the finance industry at the time, but went through incorporating, starting to pull together business plan and everything to go to market and who we're going to sell to, all that. And I joined the Mars Discovery District, Toronto's Innovation Eco Center, as a customer. They had, in May of 2015, a conference called the Health Kit Conference, where they're taking their promising healthcare technology startups, putting them on stage in front of 300 investors. And I had fever dreams that I was pitching here, but I wasn't doing it full time. So the event was May 5th, and on May 1st, I quit my job so I can be on stage all in, ready to go. I got up, I did my pitch, said everything I wanted to say, and I said, I have a booth just over there. Come on by, we'll talk about investments. And not a single person came by. And that was absolutely sobering, an absolutely terrifying experience, thinking, oh my gosh, I just quit my job and I didn't get funding. But I learned from that I was very early stage. I didn't have any validation that this idea was going to fly, that this idea was going to have any kind of product market fit in any kind of niche. So what I did for the balance of the year is I went around to anybody and everybody that I thought could feasibly be a customer of this product. Going to home care agencies, to residential care facilities, to pharmacies, to pharma companies and contract research organizations, anybody that had anything to do with medication adherence, pitched them the idea and got letters of intent that would say, if this product would exist, I would be a customer of it. And that what let me go and get funding to build a proof of concept. So the first dollars that came through the door was actually a grant through the Ontario Centers of Excellence. I think it's now rebranded to the Ontario Center for Innovation. No, they had a $30,000 grant. It was a matching grant, and so what I would do every time, I think it took 3 or 4 applications to get. Every time you had to have 30 grand in your business bank account. So I'd take money from my personal line of credit, put in the business account, take a screenshot, and then send it back to the line of credit. So, but eventually, no, we got that funds. Same day when I got notification of that, I was in a founder community, and one of the other founders said, "Hey, congratulations. How much more do you need to get to your proof of concept?" And I said, 15 grand. And so that was the first investor that we brought on. It was a very straightforward deal. It was $15,000 for 1.5% of the business. And so straight common equity, very, very easy deal, nothing to really talk about there. But then that allowed us to get the next 45,000, where the people that did the work to build the proof of concept, it was a design firm out of Toronto called Cortex Design. They were willing to do a 1-for-1 match, where for every dollar that we hired of their services, they would do $1 of in-kind services. And so since we had raised 15,000 at a 1 million post-money valuation, we brought that $45,000 in at a 1 million pre-money valuation. So technically, as far as a cap table is concerned, they were different rounds, even though they happened a couple of weeks from each other. So that $90,000 allowed us to build a proof of concept prototype that was more than an ugly plastic box, but was something to get people to believe in the product and believe in the vision. That then got us to that went too far. Got us to getting another $30,000 grant to build the very first iteration of our software. So 2016 was just getting dribs and drabs of funding in small, very basic deals to get a proof of concept to get us to a point. 2017 is when we got our seed financing. Now, it wasn't until the later half of 2017, and so throughout that year, we were still very lean and very mean. Here's a photo of Pascal, myself, our chief technology officer, and one of our marketing people. All hands on deck. This probably would have been 6, 7, 8 o'clock at night, putting together devices. Those devices are right here, made out of off-the-shelf cell phones and 3D printed parts that went out with our very first usability study that Pascal ran with the University of Toronto to see how does the adherence of a device like this compare to a pill bottle. Now, I think these didn't work very well, and so it was more or less treated as a glorified alarm clock, but still was a really nice validation point to get and help in that fundraising effort. And it really did, being so close to the device and the prototypes, it had us become very aware of the cost of prototyping. Where in the first one from our design shop, you see on the left, it's a button extender that was CNC'd and painted and cost us $100 to build. Whereas when we used this straight, didn't care about the very specific tolerances and the color. We use a 3D printer from a 3D print shop, and they said, "Look, this is so small, we're just going to give it to you for free." So things like that were learnings of methodologies early on. Of yes, you can go and in the grand scheme of things, $100 isn't a huge deal, but the mindset of going into we need to save money when building product and building prototypes. It takes a startup a long way. So we did a lot of showcasing, going to conferences and so on with our proof of concept prototype to generate awareness. And eventually we got connected to a company called Centric Health. Centric Health is and continues to be, but under a new brand name, CareRx, Canada's largest multi-dose pouch packaging pharmacy. So that machine that I showed you earlier, Centric Health, that was their business. And so we were lucky to get connected with them as a strategic investor. They led our relatively large, by Canadian standards, $2 million investment at a 10 million post-money valuation for a pre-market company. But because of the strategic nature of the business, to give them a competitive advantage, it made a lot of sense. And the day after we announced the investment, because we announced after market hours, their stock price went up by over $15 million. So it was a pretty strong immediate return on their investment to be investing into new technologies. The way the deal was structured is we got $1 million on closing, and then another $1 million once we met some milestones, which was completing the DFM, which stands for Design for Manufacturing, that was to be completed in early 2018, as well as they got 1 board seat. Now that brings us to 2018, where we had planned our launch in Canada. But what happened between the investment and that launch in Canada is Centric Health had a change of management. So their CEO was no longer the CEO, and their chairman was on his way out, which was problematic because a company investing in you is really the leadership or the decision makers in a company investing into you. And the person they put in charge was very much not a visionary, very much not there for growth. He was there to optimize and sell and move on. So there really wasn't a good match, and I'd say that's a huge risk when you give up a board seat. It's very possible that the people that initially sit in it, and it happened to us, they were very supportive. We got someone that wasn't very supportive. And that was especially awful, to say the least, when we did not meet our design for manufacturing date. We almost did, in the sense of we had a design. We built 7 initial prototypes of that design to prove out that they went together well and that they worked. We all rolled up our sleeves and were part of that process. And they took many hours to assemble, and they had something like a 2 to 4% failure rate. And when you're dealing with patients' meds, something like that is absolutely unacceptable. So made the very obvious but hard decision to redesign or go through another design iteration and to delay launch. But what that meant is that we now had to renegotiate our second tranche because we didn't meet the terms to release that tranche. And I can tell you that is not a fun place to be. No, I don't know if you can see it on camera, but I have a lot of gray hairs on the side of my head. And I can definitely attribute a few of them to the beginning half of 2018. But that's to say, we that 1 million tranche got switched into 3 sub-tranches of 500,000, 200,000, 300,000. Centric got an extra 2.5% equity, as well as an additional board seat. So it definitely bumped our chin, scraped our knee, but it wasn't in the end detrimental to the business. So forwarding to 2019, finally we get to launch a market. The tranches did release on schedule, and throughout the year we had done a fair bit of content marketing. Going out, doing talks, getting talks at conferences, getting our product and business into lists of top med dispensers and so on and so forth. And just a couple weeks after we became commercially available in Canada, we received a call from a company out of the UK called Focus Cura. Not the UK, a company out of the Netherlands called Focus Cura. One of the best calls you could ever possibly receive as a startup. Just launched your product and someone's saying, hey, I would like to have 6,000 devices. And I go, where in the world are you? Amsterdam, I'll be there on Thursday. No, had a pretty solid week booked, and so from door to door, from when I left my house to when I got back to my house was 50 hours, 50 hours. So it was a blitz of 2 days, but I'd say it's some of the most valuable 2 days to the business, because this contract essentially made the business where they had an existing dispenser that was catching on fire in patients' homes. So part of the process was deploying fire extinguishers with the dispenser, and they had to quickly change them out with a new solution. There was some European localization tasks we had to do, so we charged them 175,000 euro to complete that. Had some pretty nice contract terms that on the initial devices would generate 3 million in annual recurring revenue, and they got exclusivity across Benelux. That if they maintained that exclusivity over the next couple of years, we would have annual recurring revenue of 18 million. So on the heels of that, still growing the business, expanding the team, and so on. Throughout 2019, we knew we weren't ready for the Series A financing because we wanted to be in market for that. We raised some angel financing. So I imagine Pascal talked to you about the SAFE investment vehicle. It starts for a simple agreement for future equity, where an investor essentially writes you a check for an agreement that they'll get equity in the future. What it allows you to do is take the negotiation of a valuation off the table, but it gives the investor upside protection in the case of the company doing really well. And that comes in the form of a cap. So you have an agreement that this is going to turn into equity, but it's never going to convert at a valuation higher than 33 million. So say we raised at 100 million, they would get that 33 million valuation. Then further on top of that, say it raised at a valuation of less than 33 million, then they would get a 20% discount on that raise. So it really, actually, I think it came out of Y Combinator, which is an accelerator in Silicon Valley, and we found a lot of success raising with angels. Later on in that year, when it came time to, we finished the European localization and became time to build devices. Building devices is expensive, and being, essentially, we had some revenue, but we were still essentially a pre-revenue company. Not a lot of places want to give you the money to build a product. And it cost us, $250, $300 to build each unit. So we ended up going to the BDC, the only bank that was willing to give us $1.8 million. But it was a painful $1.8 million to take. Because on the surface, it was a 12.05% interest rate, which in 2019, when interest rates were hovering around 3%, was really high. They broke that into two tranches of 600,000 upfront and then 1.2 million in March of 2020, which you might recognize that date as a very stressful time in humanity. But the kicker on it was the fact that this loan had a balloon payment at the end, which essentially made the effective rate of the loan at a little over 21%, which is crazy to think. Just imagine putting $1.8 million on a credit card. But that's what we had to do. That was available to us, and financially it added up. So we went forward with that $1.8 million loan, which brings us to 2020, when we were raising our Series A. And on the entry of 2020, we were in discussions with a group called Goodwood Funds. We're going to bring in $4 million from Goodwood at a 16 million pre-money valuation. And this wasn't a stock deal. This wasn't a preferred deal. This was a combo common equity and royalty deal, where every $100,000 would get an investment unit that would come with $50,000 of common stock at that 16 million pre-money valuation, and one royalty unit. And a royalty unit would generate 0.175% of the top line recurring revenue of the business. So across the 40 royalty units, we would be paying 7% of our top line recurring revenue year over year. We were given a buyout schedule where year one would be 100,000, which would have been a 200% or 100% or plus 100% return on the royalty aspect of the deal. Then year two that increased by another 100%, year three another 100%, and so on and so forth. And so this was a okay deal. I actually personally liked it because we didn't give up that much equity, and the equity on the long term is more expensive than a royalty. But I had a hard time getting the board of directors around to it. We were getting there, but then March 2020 happens and COVID hits and the markets blow up. And Goodwood said, look, we have people pull out some cash. We lost a lot of our investments, and we no longer are making investments into high risk startups at this point. So shoot, that sucks, especially because if you can see this slide, this is what our bank account looked like at the beginning of 2020. Our operating account had $0 in it, and our savings account had $14.23 in it. And at that point, we're a business of, I think, a little over 20 people. Payroll's coming up. People's livelihoods are relying on their salaries. Yikes! That is not a fun place to be in. But BDC did come through, and so you can see, I think this was March 3rd of 2020. You can see it later, March 16th of 2020. This is what our bank accounts look like. So crisis averted, but yikes, that was close. So where we were at that point in time was great. We have a little over 1.2 million in the bank. We need some more cash. And the Goodwood deal fell through. However we get it in, the better. So we ended up finding another government loaning organization called SOFI. Stands for the Southern Ontario Fund of Investing in Innovation. And we closed an additional $500,000. Very straightforward vanilla loan, 12%, interest only for the first 6 months, and then paid out the rest, a combo principal and interest over the 54 months after that. So very straightforward, very basic loan, but had us continue to be in a position to grow and close more deals. And that's when we got our next large distribution deal. This came out of Norway with a company called Dignio. They needed more substantial localization. They may want to make some hardware changes to our products, so we charged them 500,000 euro upfront to make those adjustments. But they had a 4,000 device order. Fully rolled out would be 1.8 million ARR, and if they maintain their exclusivity, it'd be an additional 16.5 million ARR. So at this point, we have our second contract. We're rolling out with our first. We're now, albeit COVID was making everybody worried, a company positioned very well to do a Series A financing, and we ended up meeting a group out of Israel and Hong Kong, so the Israel group is the venture capital subsidiary along with the ventures of a large conglomerate called CK Hutchinson out of Hong Kong. And we ultimately negotiated a 5 million investment at a 20 million pre-money valuation. They got a warrant. They were preferred shares, and so they had a liquidity preference of 100%. So essentially, they would get double their money before anybody else got a penny. They got one board seat, and a term that we were happy that we were able to negotiate was that liquidity preference goes away if we did a qualified IPO and raised at least a 100 million pre-money valuation with 25 million or more raised. Now, what happens very commonly after a Series A financing is the Series A investors want to put in their own CEO. It's very common across all industries with VC investment, where the founding CEO generally lasts between 6 and 18 months. And so for us, on the 6 we were closer to the 6 side. And I think this slide expresses how that went. Where our VC investors brought in actually a really nice guy as a CEO, but very much the wrong skill set. They recruited from large, big corporate to run small, gritty, growing startup, and it didn't on the long term have a strong success. But 2020, I stepped down as CEO, took my board seat, and was to relax. But in 2021, being in that position, I would have wanted to travel, see the world. Our borders were locked down. And so what I ended up doing was joining our customer Dignio to help them on their North American expansion. Because sitting at home after 6 years at that point of, the craziness of building this business, it was truly hard to start doing nothing. So I joined Dignio, helping them with their North American expansion. And that was going quite well until the beginning of 2022, where Asage had not closed a single new contract and was going up for sale prematurely. And so I got to have the very bizarre experience of facilitating the acquisition of Asage, but on the acquiring side. So I can tell you, it was very weird, and I think Pascal was in the shareholder meeting when they had to. We were approving the acquisition, and they had to go through recitals of conflicts. And because I was on the board of both companies and I was an executive of both companies, they kept saying, Spencer Waugh, this conflict, Spencer Waugh, that conflict. I was like, oh my gosh, I get it. I'm conflicted. We can move on. But yeah, so I had a very bizarre experience of acquiring my own company. I stayed on Dignio for 7 months after that to make sure the integration of the business went successfully. And then pandemic's over. That's when my fiance and I got to go and travel the world, going to Japan, to Thailand, to the Philippines, and spending quite a lot of time in India. So that's what I had for you. Here's my career portfolio, and I will welcome any questions that you guys may have.
Thank you, Spencer. I'm going to start off with one question because just before people jump in, you made a very interesting comment when you said when there was equity and royalty, that you said that equity in the long run would be less costly than royalties. So can you elaborate a little bit? Because we're talking about cost, capital structure and, the challenges of, valuation and, equity versus debt and all that fun stuff, all the different vehicles. So that's a very, very interesting question. So what did you mean when you said that, royalties would be less costly in the long run than equity?
Oh, it's a great question. So if you think of the business as at the end point on your exit, for round numbers, think about it as say you sell your business in the future for $100 million. If you give up, call it 20% of the business now, that 20% is going to cost you essentially $20 million of future value. Whereas if you give up only 7% of your revenue on a year-over-year basis, if you take into consideration any multiple on the revenue that your business is generating that leads that $100 million valuation, you're not going to get anywhere close to that $20 million point where the equity would have cost you. So at the end point, how much you're giving up in terms of what you would get as a founder, as a primary shareholder of a business. Giving up equity means that you're giving up the most long-term upside. And a royalty, even though 7%, it hurts. It absolutely hurts to see money come in, and then that's just margin that's flying away. If you look at it on the scope of you're going to be successful and you're going to have an exit, you'll always wish you took the royalty over the equity every day of the week.
Thank you. Yeah, that's great. And that ties in to what we talked about before Spencer joined with the idea of the value neutral assessment with debt, right? It's the same idea. Debt, you owe money back and it doesn't take away from the ownership of your company. But yeah, that's awesome. Thanks, Spencer. Okay, questions for Spencer, please. Anybody, or online too. Sorry, I keep ignoring the poor online people. If anybody online wants to ask Spencer a question, please just blurt it out, or Ramiz will direct. Anybody? Questions? Yes, sir.
Well, so you mentioned like in the timeline in 2017, you were going to like all of these different conferences, and like showcasing your device at that point. But were you selling at that point? So I don't think you were, or if I missed it. I was just curious, like what exactly was the idea behind attending conferences without necessarily having like.
Did you hear that, Spencer? That's a great question. Did you hear that? It was the question is basically, why were you attending conferences and trade shows before actually being in market and selling?
That's a great question. So it's very important for the success of your product, the success of your business, to get as much feedback as you possibly can before going to market. In the sense of, we went through many iterations of our product, both on the functionality side, making sure it works, but also on the user experience side, making sure it's something that people actually want to buy. And the only way that you can understand that people actually want to buy is showing it to people as if it's real, getting their feedback so you can listen to that and make it better. No, I think there's a misconception that people have of entrepreneurship. They think of the Steve Jobs story with the iPad. To go, here's a guy, he's so smart, he had this idea to change the world. That is the absolute wrong way to think of it. It's to as an entrepreneur trying to come up with a solution. It's as an entrepreneur, you're identifying a problem, you're identifying a gap, and you have a hypothesis that could fill that. Take that out and get as many people to beat it up as you possibly can, so you can then go, okay, I'm gonna make this better and actually build something that people want. And so that's what we were doing going to all those conferences, is we had that works like proof of concept prototype. What existed in the world at that point in time, but people got to touch it, feel it, smell it, do what they needed to do. And we would listen to make sure that what we ultimately went to market with was actually going to meet people's needs.
Yes, sir.
What was your IP protection strategy?
Did you hear that, Spencer?
Our IP protection strategy. So it's I have an interesting viewpoint of IP protection, which is get IP. You need to have IP. Any angel, VC, private equity is going to have IP on their list of boxes you have to tick when making an investment. But the reality is at AceAge, we were never in a position to defend our IP, where say Amazon or Google or even other well-funded startup were to come to market and breach our intellectual property. Would it be worth our dollars to spend hundreds of thousands, if not millions of dollars, to sue a company, to put together the case, to hire the lawyers and actually defend it? The reality is no. The only time that you're ever going to do that is if you've really hit it big, you've grown the business and it's on a crazy trajectory, you're IPOing and all that stuff, where you actually have the funds that it's worthwhile to defend it. Because early days, that money is worth better being successful in market. So we had IP, but it was IP for the sake of having IP, and it was fine, but it was more to make sure we checked that box to raise funds, opposed to having something that is going to prevent any new entrants.
Yeah, fingers crossed, exactly. Any other questions for Spencer? Anybody online? I can check I'm sure Ramiz is going to help us. Nothing in the chat, I don't think. No, okay, good. No other questions? No? So yeah, sure. Last question, go ahead.
I was just curious again, like, how do you end up like finding Centric Health, or like your first major angel investor? That's where it was kind of. I don't know.
So how did you find your investors, Spencer?
So I was I had a booth at a contract research organization conference in Quebec from one of the companies that we had an LOI with called Vantage Biotrials. And at that conference, there was a guy named Brendan Byrne that was running TELUS Health's innovation accelerator. And he saw this product, he said, "Hey, have you spoken with Centric Health?" And at that point in time, I'd never heard of them. And so to Jackie Shevel, who was their chairman, he made a warm introduction to me and our product. And so it was through one of those conferences that we're doing for early stage validation that I met somebody who made an intro.
So networking.
Lots of networking.